Friday marked Veterans Day here in the U.S. In honor of service members who have not been identified, Vice President Harris marked the federal holiday with a wreath laying at the tomb of the unknown soldier at Arlington National Cemetery. Despite major legislation this year known as the PACT Act to help service members exposed to burn pits, Agent Orange, and other toxic substances, some are still not getting the help they need. A recent CBS News investigation found hundreds of veterans deployed after 9/11 to Karshi-Khanabad Air Base, known as K2 in Uzbekistan. They reported rare cancers and other illnesses they blame on toxic exposure and high levels of radiation. You see some of that there. A leading advocate and Army veteran, Mark Jackson, served at K2 for 10 months between 2003 and 2004. The same day the PACT Act was signed, he was notified that an essential medication would no longer be covered. He joins us now with more. Mark, you've told CBS News that you are what a loophole looks like. Talk about your recent hospitalization and the insurance challenges that you're facing.
Yeah, thanks, Catherine. Thanks for having me. The PACT Act does wonderful things, and it's the first time in a generation since the DoD and the VA acknowledged that Agent Orange was an issue that there's been legislation that covers down on a lot of these diseases and disorders. The issue is that there are loopholes outside of some rare cancers, outside of some gastrointestinal and respiratory diseases. You have people like me who have osteoporosis and anemia and who have been denied coverage by both the VA and insurance. And we're left in this odd sort of limbo wherein it's as though we're not dying the right kind of death for the government to cover.
Just walk us through your last hospitalizations. We've got some photos from that. What happened? And did you find yourself worrying less about your health and more about how you were going to pay your bills and get the drugs you needed?
Right. After it was clear that I was going to survive, what became then, how much is this going to cost? And I am fortunate in that I have very good health insurance through work, and I use the VA for almost nothing. I have a slight rating. But in this particular case, I had a systemic infection in my elbow. This is just bursitis, except I don't have a career field or an athletic event where bursitis should happen like this. It's happened in 2 years to me in opposite arms and has required hospitalization and ultimately blood infection for me to get out. I was in the hospital for almost 5 weeks, just got out a month ago and just had a PICC line taken out just to make sure that whatever this infection is doesn't kill me now.
Well, we're glad you're out of the hospital. I want to give people some of the backstory here. So tell us about the conditions at this base where you served and what the evidence is that there really was significant toxic exposure.
Yes, so Karshi-Khanabad, also known as K2, was an air base in southern Uzbekistan. It's where the Soviets began their invasion of Afghanistan, and it's also where the United States began our invasion of Afghanistan. It was an old Soviet base. It was filled with toxins. Nuclear explosions had occurred nearby. The Aral Sea, which is only 500 kilometers away, would blow across this base. And also you had petroleum and about 500 other carcinogens that were present on this site. That's according to the government's own documents that we've recently got by requesting that. So what we had is about 16,000 people that went through K2, of which over 60% are sick. And this is part of, but also unique against the burn pit issue. Because K2 had a burn pit, but we also had all the other things that the Soviets put there for 70 years.
That's a huge number, 60%. Based on a CBS News investigation, an executive order was signed and a promise to do a scientific study to make that linkage between toxic exposure and some of these illnesses. Where does that stand?
Johns Hopkins University has been directed by Congress to do a longitudinal study that will last about a decade, and then we'll go every 5 years after that. Catherine, the problem with that is that we have a finite amount of time. My body will not survive their timeline, nor will many others. So what I'm pushing for, and what they've radicalized me, and I use that term on purpose, is that if someone who is a veteran who served in a place like this, look at what's on your own screen. If we serve there and we are sick, why should I have to prove anything?
Well, it sounds like we got a follow-up here at CBS News on that timeline for the scientific study on the exposure and the linkage to illness. Mark Jackson, thank you.
Thank you, Catherine. It's always good to speak with you.